Hey everyone, Dr. Michael Neely here, and welcome to Dr. Neely's Bodywork Minute. Today we're going to be talking about quality of touch. Now, as body workers and people that work in manual medicine, touch is something that we do all day long, every day when we're working with our clients and with our patients. And I think a lot of the time we take for granted the reality of the quality of our touch in terms of how our touch is being received by the people that we're working with and working on. So what we want to do today is look at the factors that influence that quality of touch, what our clients and our patients expect from us, what they need from us in terms of allowing us to touch them and have a therapeutic positive intervention occur. And then we're going to look at factors that we can do as providers to make sure that we're giving that highest quality touch as possible. Okay, so let's first look at what the client or the patient is expecting from us in terms of what they need. Okay, so first off, and the most important thing obviously is trust. They need to be able to trust that we know what we're doing. They need to be able to trust that our intentions are good and appropriate so that they can relax and allow us to help them through the modality of touch. Now, while this is usually mostly about bodywork and manual medicine on my blog here, these are actually true all across the professions. These factors are true across the professions in healthcare. It doesn't matter what field you're in, because one thing that we're doing, whether you're a body worker, whether you're a physical therapist, chiropractor, massage therapist, whoever you are in the manual medicine field, if you're a nurse practitioner or a primary care doctor, you're also doing physical exams, and the quality of your touch is extremely important. So the first and overarching thing is that people need to be able to trust us to allow us to touch them. And it's true that there is some implicit level of trust just by the fact that we're healthcare professionals, but that's not everything. It's not 100%. And I've heard many times over the years that people appreciated a particular practitioner, whoever it was, but they didn't feel like they knew what they were doing in terms of putting their hands on them and figuring out what's happening, or with a particular intervention. And a lot of that is the quality of touch that you're exchanging with the people that you're caring for. So how do we build that trust with people? Well, first off, of course, they have to have confidence in us. They have to have confidence in our knowledge base, in what we're doing, understand that we actually know what we're talking about. The second thing is compassion. So in terms of compassion, a lot of times we think of affect, of how we appear to someone or how we speak to someone, but it's also in our touch. We can have a therapeutic, compassionate touch versus, if you're thinking about something else often, in your life or something, a lot of time the quality of compassion cannot be necessarily exchanged in your touch with the person you're working with. So that's another thing that is expected of us. And then listening. Many, many, many times our clients and our patients report later, often to somebody else, and I hear this often, that they weren't heard. Somebody goes to see a particular practitioner and they're not being heard for what they're saying. The practitioner is stuck in an algorithm that they're working through. Oh, you have this symptom, you have that symptom, and then therefore it's this. And they're not hearing what's coming out of the client or the patient's mouth. So listening is extremely important. And so if you combine confidence, compassion, and listening, those expectations that they need from us, then you will gain their trust, and then you can enter into a positive therapeutic exchange with your client or your patient. At least you can have, beyond the road to having a higher quality interaction and have that higher quality touch to have a better outcome. So as providers, what can we do to make sure that we are meeting these expectations and these needs of our clients and our patients? First and most important thing in my mind is understanding the anatomy that you're working on, understanding the potential problems that person could be suffering from, so the pathologies or the injuries or problems there. And yes, it's true. I'm a little bit biased because I've been a professor of anatomy and physiology for a long time, in addition to my clinical practice. But the reality is, healthcare is kind of like a Sherlock Holmes mystery, and the more that you know, the better off that you're going to be and be able to help people. So, and then across the board, anatomy is not static. We're learning new things all the time. The anatomy and physiology of the human body. There's a huge amount of biological diversity between person to person. Some people can have organs in the quote wrong place, or they can have a missing muscle that someone else may have had because of a congenital defect or something like that. And this happens all the time. So our expectations and our understandings as providers are bolstered by the more we know with the anatomy and the physiology and the potential problems that are going on. And that will help boost confidence in what we're doing by knowing the anatomy and potential pathologies as well, within whatever that is for your particular profession. Next step, when you're moving into before you are going to touch a client or a patient, you have to have a game plan of some sort, right? And this is, you want to have a sense of what you're looking for. And this is just kind of the next logical step from anatomy and pathologies, is that, knowing what you're, hearing what they're saying, and knowing what you're potentially going to be looking for will help you have a sense for what you're looking for when you put your hands on them. One of my mentors, dean of clinics from my school years ago, he had a saying that 95% of what you're going to find on a person comes from the history. A lot of times we rely on a palpatory exam. If you're a massage therapist, you might think you can feel what's going on, and you can, and a lot of the time. Or you might think if you're a chiropractor or an orthopedist or whoever, that orthopedic tests are going to help you isolate what's going on, or a physical therapist, that those orthopedic tests are going to be more reliable. Almost always, if you take a detailed and good history, then that 95% of what you think is going on is going to be figured out in that discussion. And that will also aid to your credibility that you're listening and hearing what they're saying, right? Adding to that trust component. So listening to somebody, and then you go in and then you do your palpatory exam, whatever it is, then you've got that game plan going in, and then you can move forward, and they'll have more confidence in you. They'll have more trust with you. Next point is intention. So this isn't esoteric, all right? I'm not talking about like setting an esoteric intention. I'm talking about when you go to put your hands on somebody. If you understand the anatomy and the potential problems, and you have a game plan and a sense of what you're looking for, you're going to be more sure of yourself in how you put your hand on that person, because you're looking for a particular issue in a particular area. You know what's underneath your hands, more or less. You know what you're trying to find, and so therefore you're going to be more sure of that touch. You're going to have that sense of sureness in your touch. You don't want to be tentative in your touch. That puts everybody off, whether they know it consciously or not. So you got to go into working with your client or your patient with your touch with a sense of sureness. And you also don't want to be, on the flip side of that, you don't want to be aggressive. You don't want to just go in and go for the full-on spot grip and grab their trapezius muscle or something like that. That doesn't go over well ever, right? You definitely can have a more firm grip when you're working with somebody eventually, but you need to work into that. So make sure that you have a sure intention when you go to put your hands on them. Next part is communicate. Okay, and a lot of people, if you're working in the spa industry or you're doing relaxation massage and you're not having people talk to you while you're working on them, that's okay, because that's a different type of treatment and intervention, right? The whole idea is to relax. But if you're doing any kind of injury treatment work, you need to definitely get in the habit of communicating with your clients and your patients. Get feedback with them on a regular basis. And you can let them know what you're feeling. So, for example, patient comes in and they have pain in the cervicothoracic region, and so you hear what they have to say, and then you put your hands on, you go behind and check their neck and their upper back, and then you notice that the levator scapula is extremely hypertonic, and so you say, well, what I'm feeling here is your levator scapula, which is the muscle that attaches the top of your shoulder blade and goes up into your neck, that's extremely tight, and I'm betting that it's pretty painful. And then they say, oh, Yeah, it is actually. How did you know that? And I was like, well, I can feel that this muscle in particular is tight, and I'll bet that this is part of your problem. Or let's say that they have headaches, and then you go to the suboccipital region, and you put your thumb in there, and you find a trigger point, and you say, hey, there's a focal spasm here. This is called a trigger point, and I'm betting when I palpate this, when I'm putting some pressure on it, this is recreating the headaches that you're having. Oh, yeah, it is. So that kind of interaction with people as you're examining them, as you're initially letting them know what's going on, it feeds into that confidence for you, and then it aids in gaining more trust with that you know what you're doing, and then they're going to be able to relax more and have a better outcome. The other part of communication is continually getting feedback. If you're doing injury treatment work, it's very, very important that you get in the habit of asking people where they're at. And I would say in a 15 to 30 minute interaction, which are relatively typical for me, I may ask somebody 10 to 20 times when I'm doing body work on them how things are going. What pain level is this at? I'm hoping that this is somewhere between a 5 or 6, or if you don't like numbers, 5 or 6 out of 10. Or if you don't like numbers, then I'd like to have this no teeth gritting. I need you to be able to relax so that this is going to work well for you. And the more that you communicate with people, at first they may think that you're not sure of what you're doing, but very rapidly, particularly if you bolster this by saying, I know what I'm doing, I don't know what's going on inside you. I can feel where a muscle is tight, I can feel what's going on, I understand what's happening in your shoulder or in your back or in your neck or whatever it is in terms of what I think is going from an injury standpoint and the anatomy standpoint, but I can't feel what you feel. Everybody's got different pain levels, pain tolerances, and I need to know from you that things are going well. And so that communication gives you constant and good feedback as to whether you're continuing to help somebody and hopefully not hurting them when you're working with them. So get in that habit of communicating with your client or your patient if you're doing injury treatment type work. Okay, so the next thing that we need to think about is utilizing graduated touch. So what I mean by graduated touch is that you work lighter to deeper, just like we learned in school way back when. There's an emotional reason for that in terms of working with your client or your patient, because you don't want them to tighten up or react to you going too quickly when you're working with them. But there's also an anatomic and physiologic reason why you want to do that. If you remember way back when to your anatomy and physiology class, that we have mechanoreceptors in our skin. Those are the corpuscles of touch that give us feedback about what we're feeling. And those are all in the dermis. That's the middle layer of your skin. And so at the top layer of the dermis, you have what are called Meissner's corpuscles. And then in the middle layer, you have what are called Ruffini corpuscles. And in the lower layer, you have what are called Pacinian corpuscles. And if you go too deep too quickly with your palpation skills, you use too firm a pressure, you obliterate that information that's coming from the Meissner's corpuscles, which is different types of information than you get from the Ruffini and the Pacinian corpuscles. So you want to use a gradual touch as you're working your way in. If you want to feel edema in the tissues, or you want to feel whether something is indurated, like it's attached underneath the layers of the epidermis rather than freely mobile, or the dermis itself, then you need to use a lighter touch to initially start and feel those things. But if you need to get in and palpate a deeper structure, then you go gradually and slowly so there's no reactive tensing or spasming, and then you work your way down into, let's say, the iliacus to try to find a trigger point in the iliacus. And you don't want the patient or your client to tense up, and you don't want to cause them too much discomfort as you're working your way in there, but you do need to get in there. And then once you work your way in there slowly and gradually with that graduated touch, you find the trigger point, and then that reproduces the pain that they're suffering from, and you go, okay, great, I think I can help you with this. So use that graduated touch. The next quality that I want to talk about is what is called responsiveness. And what I may mean by responsiveness is your responsiveness to what you're feeling when you're working with somebody. And so a lot of times what happens is if somebody is working and they're going in, even if you're using a graduated touch and you're coming in, if someone tenses up, a lot of times the practitioner will just pull their fingers off and they say, oh, geez, I'm sorry, And I would encourage you, rather than just pulling your fingers away in most cases, unless it's a really severe reaction, back off slightly. and see if they can relax into it and say, oh yeah, I can tell that that's a little too much. So hey, how's that now? Is that okay? I want this to be around a 5 or 6 out of 10, or no teeth gritting, depending on whether you use numbers or not, or whatever it is for them, that they can understand that this is a tolerable spot to work with. And then you slowly hold that, and then you start working your way back into the tissues, and then release the structure. So that's responsiveness. You're responding to what you feel in the tissues, their reactions to what you're doing, so that ultimately you can hopefully accomplish what you're trying to accomplish when you're working with these people. So just as a quick review for the providers, it's only 6 things that I'm talking about. It's understanding the anatomy and the injuries or the pathologies that may be going on. It's having a game plan so that you have a sense of what you're going to be doing before you go to touch someone, and having intention with what you're doing, so that you're not tentative and you're not too aggressive. You're going to go in and you're going to do what you need to do, feel what you need to feel, and they understand that that's what's going on. You're communicating with them so that they understand why you're touching them, where you're touching them, you're listening to what they're saying and getting feedback about what they're saying. You're using a graduated touch so that there's less chance of reactive tensing, and they're more comfortable with what you're doing, and then you're being responsive to what you're feeling. Those are the 6 factors as a provider that you can have the highest quality touch when you're working with somebody. Utilizing those 6 factors is going to gain you the ultimate goal, which is the trust of your client or your patient. And that all those 6 things are going to help them have confidence that you know what you're doing and why you're doing it. They're going to feel the compassion not only in your affect but in your touch, because you're responding to what you're feeling, and you're listening to them and hearing what they're saying, so that they're more likely to trust you and have a positive outcome all around, and heal and get better quicker. So hopefully you enjoyed the video, and if wherever you're watching this, please leave a comment, share it with your friends, with your peers, and let's get out there and help people. I'll see you next time.